Good morning, everybody. Thanks so much for being with us. My name is Angie Bailey, and I welcome you on behalf of the Miramar Pembroke Pines Chamber of Commerce, as well as the Weston, Florida Chamber of Commerce and the Pembroke Park West Park Chamber of Commerce. Across our business community, healthcare is one of our biggest sectors. So today's conversation, brought to you by our healthcare committee, is about kickstarting your health. Not perfection, not overhauls, but just smart, sustainable steps that we can take when we look at our physical health, movement, and injury prevention, mental health well-being, and how to actually use insurance benefits that we're paying for. So I want to briefly introduce each of our panelists with us today. Dr. Matthew Goldman is a board-certified family medicine physician with Cleveland Clinic, Florida, specializing in preventative and patient-centered care. He's a fellow of the American Academy of Family Physicians and actively involved in medical education, digital health, and community outreach. Josette Mullins is the director of rehab services at Memorial Hospital Miramar with decades of experience in physical therapy. She has specialized training in lymphedema therapy and pelvic rehabilitation and deeply focused on helping patients move safely and confidently at every stage of life. Monica Arroyo is a licensed clinical social worker and clinical director of Family Therapy Group of Weston with more than 20 years of experience. She specializes in supporting individuals, couples, and families through stress, burnout, and relationship challenges using evidence-based therapeutic approaches. And Carol Cook Dixon is a health insurance professional with over 25 years of experience helping individuals and businesses navigate health coverage. She works across Medicare, group plans, and marketplace options with strong focus on helping clients fully understand and maximize their benefits. So today's goal isn't to overwhelm anyone. We want to help you take the smart, realistic steps to kickstart your health. So what we're going to do today is rotate through our panelists so you can see how physical health, movement, mental well-being, and insurance all connect. So let's start with talking about how to get started, right? Dr. Goldman, my first question is going to be for you. What's the purpose of a routine physical and how often should we be getting one?
Hey, MG. Good afternoon, everybody. Thank you for having me and thank you for the opportunity. The purpose of a routine physical is an opportunity for the patient and the provider to come together to figure out how the patient's doing, what trajectory their health is on, and what decisions to make to ensure that the patient is improving their health and optimizing their health at the same time. It's also an opportunity to review the patient's medical history, medications, supplements, allergies, family history, and much more. It's also an opportunity to check for some of the silent risk. The silent risks typically are blood pressure, blood sugar, cholesterol, screening for cancers, and more. To ensure that the patient's up to date on their recommended screenings and also vaccines. And then to set a plan, goals, how to reduce risk, when to follow up, etc. How often should one get one? I'd say there's no one-size-fits-all schedule. It really just depends on the patient's age, risk factors, conditions. Some people do it yearly. Some people come in more often than once a year. It just, again, depends on how healthy or unhealthy the patient might be. A good rule of thumb is, if the patient has more conditions, or if they take more medications that need monitoring, or if they have new symptoms, it's important to come in more often. And one note regarding Medicare, the annual wellness visit is a preventative plan and is not the same thing as the hands-on physical exam.
No, that's important. So when someone understands where they stand medically, the next step is usually let's talk about movement, but safely. So Josette, my question's for you. When someone is starting or restarting fitness, where should they focus most? Strength, endurance, balance, flexibility, or all of the above?
Actually, it's all of the above. And it also depends. I can say that it depends on what your goal is for the new year or for whatever fitness goals you have, your activity level, and also your age. I know that as we grow older, our priorities change. So the rule of thumb for us as physical therapists, if there's something, and it's probably the easiest way to determine what you need to focus on, is if you feel stiff, then you need to work on your strength and your flexibility. If you feel weak in some places, then you focus on the strength building of those muscles. And then if you feel as if you're tired all the time, then you have to work on your endurance. So, but really the goal is to work on all of them. Especially if we, as we grow older, our balance becomes, harder to maintain. Then you have to work on the strength and the flexibility in order to improve the balance. First of all, I would work on the posture, okay, because especially now that we're always, working on the computer, working on our cell phones, posture is very important because you focus on those core muscles. And you don't have to, when you're trying to get your fitness goals, try to think of micros instead of macros. Work on little steps at a time, because some of us would want to work, when we are making our goals, we want to say, oh, I'm going to, lose 60 pounds. Okay, but that goal can be so daunting to most of us that, we start really well during the first month, and then the second month, we just fail. So in terms of, starting your goals for fitness and movement, try to think of small things first. Like instead of saying, I'm going to lose 60 pounds, try saying, I'm going to start walking for 10 minutes each day. And then you add 10 minutes each day, work on that endurance. And then once you're done with the endurance, then you can start adding weights to your physical fitness.
That's wonderful. And you make a great point about, long-term sustainability. And we're definitely going to talk about that. So I'm excited that you brought it up. But a lot of people hesitate to bring that first step because they're worried about either the cost or the coverage. So Carol, my question is for you now in terms of getting started. What does maximizing healthcare benefits really mean? And what preventative services are typically covered that people don't realize are covered in their insurance?
Hi. Well, first, hi everyone. It's great to be a part of this panel. To maximize your health benefits in 2026, I've focused on three areas. One, leveraging the no-cost preventive services. Two, utilizing those tax advantage accounts, HSAs and FSAs, strategically timing your medical procedures, and most importantly, are you accessing all those hidden perks and discounts within your benefits? So let's specifically talk about the preventive services. The Affordable Care Act mandates 10 essential benefits within every plan. Three categories: your annual wellness visits, schedule them, they are all covered at 100%. Screenings and immunizations, flu is going crazy. These cover free blood pressure checks, your cholesterol checks, diabetes screenings, depression, flu shots, abnormalities. These are all covered at 100%. Then your cancer screenings, your, depending on your age and gender, once you're over 45, services like your mammograms, your colonoscopies, contraceptive counseling, all these things are covered at zero cost within your health benefits. We find that only 8% of Americans are really using these benefits. They go to the doctor and then that's it. And then the year is ending and they say, oh my goodness. So these are many of the screenings that you need to use within your health plan benefits, which cost you zero.
Absolutely. So that's a great point. Make sure that you're looking at the timeline of your insurance, that you're using all those benefits. So like Dr. Goldman said, those things that, you need to schedule at least on an annual basis, you're looking at your healthcare, benefits and making sure you're using all of those. Let's not leave anything on the table, folks. So Monica, my next question is for you. So sometimes even when care is available, right, mental and emotional barriers can still stop people from following through, right? So what are some practical strategies that adults can use to manage stress and anxiety when you're trying to make these healthier changes?
Thank you, Angie, for having me here today and talking about this very important topic. And like everybody has said, sometimes we prioritize our physical health and we tend to leave mental health to the side because we just figure that it's going to just get better. But what we do know is that when we are stressed out, when we are over anxious, and it impacts also our physical health. So some of the big tips that we give is, number one, just recognize when you're feeling overwhelmed. Are you feeling frazzled? Are you feeling like you're trying to go 1,000 miles an hour and just your body can't go with you? Part of what Josette was saying is sometimes with age, we can't go as fast as our mind wants us to go. So recognizing when we're feeling overwhelmed, taking a moment, believe it or not, slowing down actually helps a lot. Our brain, when it's going in full force, we can sometimes grasp what we need to do. But this is where the tricks such as mindful breathing, having a few deep breaths in, deep breaths out, actually resets that part of our brain that is the fight or flight response. Because when we're stressed out, we have extra cortisol in our body that actually impacts many of our organs. But if we're also able to just take a break, if we're able to walk, if we're able to just stretch, it helps to burn out that cortisol so that it doesn't have to stay in our system. Another trick that we give is also being able to set realistic expectations of how much time we have. What are we actually able to accomplish? Because we tend to just, especially a lot of moms that tend to beat themselves up, trying to be super moms. And sometimes we just have to be realistic of the things that we're actually able to do. And if we're still feeling stressed out, we are able to lean into our support system. You know, many people we do check with their primary doctor or end up with other caregivers, such as physical therapy, trying to make sense what's really going on for me. Is it stress? Is there more to the story? So definitely, if you're feeling extremely overwhelmed, then checking in with your practitioners is an important first step.
And sometimes just getting that first step done can also remove that mental block, right? So just start with making that appointment. That should just be the first step. Let's just put this into tinier chunks and let's make that appointment. Let's get into go see Dr. Goldman. Let's get our physical therapy done with Josette, all that stuff. So wonderful. I want to talk a little bit more about the follow through. So what comes after that first step? Dr. Goldman, what should someone do ahead of a physical to make the visit as useful and productive as possible?
Yeah, thanks, Angie. And great points, everybody. I think this is, in my opinion, probably one of the most important topics I'm going to cover. Preparing for the visit is very important. How many times does somebody show up and, try to recall what's on their mind, what's been going on lately, and then leave and then realize that they didn't cover what they needed to during the appointment and then reach out after the appointment. So if you could dedicate some time to jotting down maybe the top 5 priorities that are on your mind that you want to make sure get covered during the appointment, I would very strongly suggest you do. What questions do you think you want to ask? What symptoms are you having lately? What goals do you want to achieve? I would also suggest that you bring in a list of medications and supplements, and more specifically, the names, the doses, and how often you're taking them. Also, try to bring in any key updates since the last visit. Have you gone to the emergency department? Have you gone to urgent care? Have you had any new surgeries? Have you been diagnosed with anything new? Also, going back to what we were talking about earlier regarding the silent diseases, make sure you're bringing in your readings from home, your blood pressure log, your sugar log, your weight trends. A lot of devices now sync to your phone, and it's become a lot easier to show your provider during the encounter, exactly what your sleep is doing, exactly what your heart rate's doing, what your heart rhythm has been. So if you're not utilizing those devices, I strongly suggest you do. Also, bring in your vaccine records, especially if it's been a while since that was updated, because we want to know, when your next vaccines are due, and we want to make sure that you're on top of it, especially if you're going to be traveling abroad. Try to bring in outside provider records if the electronic medical record doesn't connect. So if there's someone you're seeing for a particular issue and the system that they use is different from the provider that you're working with, then there's a good chance that the provider you're working with doesn't have, your most recent mammogram, for example, or your most recent colonoscopy, for example, or your most recent pap smear or your blood work. And also leading up to the appointment, call ahead, ask if the provider wants to do anything beforehand, blood work, imaging, whatever it might be, just to help the visit itself run smoother.
That's a great point, is making sure that you know what tests might be done when you get there so that you can be properly prepared. And I'm also a huge fan of trackables. I wear mine. You don't know what your body is doing at night. And those kind of trends might be really, insightful for your doctor. So excellent point. So once someone gets the green light medically, quote unquote, questions about exercise routines and movement usually follow. So Josette, let me ask you, how often should people exercise? Our favorite topic. And for how long when they're trying to build consistency without burning out?
There really is well, there is a gold standard for that. For cardio, they want you to do about 30 to 45 minutes, 45 days a week. For strength, they want you to do 2 to 3 times a week. Flexibility about daily 10 to 15 minutes, and then balance is 2 to 3 times a week, and you combine that with the strength exercises. However, I know that it can become very daunting, to start an exercise program. So like I said earlier, you might want to just start with 10 minutes a day, walk around the block, and then the next day say, okay, I'm feeling better. Then you can go add 10 more minutes until you can build a consistent routine for you so that you will be able to follow through, not just, for a month, but also for the whole year and hopefully for the next several years. So again, consistency, in order to be consistent, also find an activity that is very fun for you. Have someone who's going to exercise with you and make you accountable for the results, so that it's not only just you, because sometimes we wake up and say, oh, I don't want to put on any of my workloads because I'm getting tired. I had a bad day yesterday, and then it's just easy to sit down and watch Netflix. So have someone who's going to be calling you to say, hey, let's go and walk, and make you accountable for your fitness goals.
Absolutely. That's a really great tip. Consistency can be really difficult if you look at that big picture of, you say, okay, 30 to 45 minutes of this, 10 and 15 of this, 4 to 5 days a week. That can easily get daunting. So like you said, just go walk those 10 minutes that first day, and we can definitely tackle that consistency. So consistency can sometimes be easier when people understand how to use tools like their HSAs and their FSAs. So, Carol, can you kind of help us clarify? There's a lot of confusion sometimes about what the differences are between the HSAs and the FSAs and how people can use them strategically for health and wellness.
Great question, Angie. So, with the exception of some group plans and some small business owner plans, many of us would have just completed open enrollment under the Affordable Care Act. Many persons don't even realize that they may have purchased plans called HSA eligible. HSA stands for Health Savings Account. These are accounts which allow the persons, the insured, the employee, to put aside money towards paying their out-of-pocket healthcare costs and reduce their incomes. There's a big difference between the flexible spending accounts, which also are tax advantage, but the FSAs are employer owned, and they really focus on paying health care costs for the immediate year, let's say 2026. HSAs allow you to put aside monies which can be rolled over from year to year to year, and these are employee owned. So for example, 2026, the government allows you to put aside $4,400 out of your pocket to cover healthcare expenses. And guys, would you believe that you can roll this over, especially you're healthy and you're doing everything that the doctors and everybody is saying? You never realize that when you come to retirement, you could probably have a real nice nest egg set up there if you're using HSA accounts. So they allow you to roll over. It's owned by you, and you can even invest in accounts like investment accounts like 401ks. They're easy to set up. You can go to your bank, ask to set up an HSA account, or some of the employers or the small business owners will work with the health insurance companies to set up those HSAs. Differently is the FSA plan. The contribution limits for 2026 is just $3,400. Never normally able to roll it over, with some exceptions, the employer's choice. It's employer owned. So if you leave the company, it doesn't go with you. And any employer sponsored plan can be used for that. So if you want to minimize, it can be that level that will get you from one tax bracket to the other by maximizing and using those HSAs and FSAs. Make sure that you check your plan to see if you are eligible.
That's an excellent explanation of the difference. So both tax advantaged, which we like, right? But one is the employer gets to keep, which is the FSA, that's theirs, and HAC is the employee directs, correct? Did I
Yes.
get
Well,
that right?
the employee puts aside the monies,
From
but
there.
one is controlled. In the FSA, the employer controls it, and it cannot be rolled over for the most part,
Gotcha.
whereas, and it has to be used within the same year, versus the HSA, which is rolling over, and it goes with you wherever you go.
Beautiful. So that's a very important distinction. I love that.
Yes.
But even with the right tools, motivation and burnout can definitely derail our progress when we're trying to get healthy. So, Monica, my question is for you. What advice do you have for people that are struggling to maintain that work-life balance and avoid burnout when they're trying to prioritize their health?
No, absolutely. And burnout is such a big topic nowadays. There's a lot of people that are struggling with burnout. And so we define burnout when we are actually exposed to prolonged stress without a break. And so the way that burnout shows up in terms of symptoms is we might be irritable, we might be fatigued, but the biggest thing is that we lose that like passion for what we're doing. We almost are disconnected from like whether it is our business or our job or the project that we were working on. So one of the best ways to manage burnout that happens to all of us is definitely taking moments to have mindful pauses, because it's not just about taking a vacation, but it's about building moments of mindfulness in a daily basis so that your brain is able to take in what you're experiencing around you. We have to do a great deal of self-care. Exercise, kind of what Josette was also mentioning, is super important to manage burnout, because it feels like we have this empty cup, and no matter what we do, it's hard to get to that place to feel like we are already beginning to feel good again. A lot of people are used to working 14-hour days. We have to be able to set clear boundaries with our work. A lot of people work on the weekends as well. And I know it feels like we're being productive, but we also have to be able to set that time between dividing life and work, prioritizing what's more important, my health. Yes, we got to keep the job, but if you are not okay, you can't keep the job. And also noticing when I'm beginning to get into that burnout. Can I delegate? Can I put other with all the AI tools now? There are there things that can be done with extra help, because we're not productive when we are actually burnout. So burnout is a big component, and as employers notice it, because the employees are not doing the job that they used to do. And so now we're having more conversations about it in the workforce when we're beginning to see the signs. And part to what Carol was saying, a lot of our health insurance covers, mental health. If you have an EAP, an employee assistance program as well, they will cover the mental health component so that you're able to check out if burnout is getting the best of you.
Yeah, and clearly early intervention is so important on so many levels, right?
Right.
Before we get burnt out, before we get injured, before we have a serious illness. So I kind of want to delve into that a little bit more, if you all don't mind. Dr. Goldman, my question for you when it comes to early intervention, what kinds of conditions or risks can routine physicals help detect or prevent early?
Yeah. So routine visits and physicals can help detect and prevent those silent diseases I was talking about earlier. A lot of people don't know if they're not checking that their blood pressure might be high, and how often it becomes high are both important. The longer it's high, the higher the risk for lots of issues in the future. Same with your sugar, same with your cholesterol, same with weight. So these are things that you do want to try to monitor and stay on top of. Also, I always tell people mental health comes first. Just like we've been highlighting throughout this talk, if your mental health is not in a good place, there's a good chance that your physical health is going to follow. So if you aren't talking to somebody about the stress, the anxiety, the depression, the trauma, etc., that you're going through, you've been through, it's definitely worth your time. I always tell people, find somebody you can work with that allows you to feel heard and validated, and vulnerable. And if by the second session, you're just not jiving with that person for any reason, maybe it's worth trying somebody else. Nothing personal. Just make sure you're getting the help that you need. Also, ensure that you're getting the appropriate age risk-based screenings. So again, checking your heart, checking for cancer, etc. Also, again, make sure that you're up to date on your vaccines and taking steps to prevent serious risks like cutting back on smoking, cutting back on alcohol, trying to eat the right foods, trying to get enough exercise, trying to get enough sleep, ensuring that you and your family are safe at home. Not always easy. Life likes to get in the way, but just make sure that you're having these conversations with your provider so you can come up with ways to navigate these avenues. And then, of course, during the physical, create a plan to reduce long-term risk. Instead of doing unnecessary broad testing, try to hone in on exactly what you need. And then I'd like to just add, a physical is a really good opportunity for your provider to listen to your carotid arteries in your neck, to listen to your heart for a murmur, to look inside your ears, to look at your eyes, feel your lymph nodes. Make sure that there's no major changes happening that you didn't realize are happening, so that you can catch things as early as possible and intervene as early as possible.
No, that's excellent. I mean, that says a lot about, we need to understand that just because we feel good doesn't mean that we can skip our physical this year. Oh, nothing's wrong. I haven't gotten sick. I feel perfectly fine. We don't know what's going on behind the curtains, right? So we definitely have to make sure someone is keeping their finger on the pulse, no pun intended, on those symptoms and those risks that might be appearing for us. So that's so important. Thank you so much. Some of those risks can also show up physically during workouts, of course. So Josette, I want to ask you, what warning signs, should someone look at, or if they need to stop exercising or seek professional care before they continue?
It's just like what Dr. Goldman said and other things. You have to look at, if you're having any chest pains while you're doing the exercises, you might be pushing yourself too much. If you have any shortness of breath, if you're seeing any prolonged confusion and wheezing when you're doing the exercises, if you're having any palpitations, if you're having any severe pain that doesn't go away, or joint pain that doesn't go away, those are things that, are signs that you might be even pushing yourself too hard, you're doing too much, or maybe the exercise is not for you. Sometimes we go in and we look at all the machines in the gym, and we're like, oh, I'm going to do that. I'm going to do that. Maybe it's not for you. You start with a treadmill. If it's working, if it's working well for you, then you add, several more minutes. And maybe the gym is not the place for you. You might want to do, dancing. You can go join some step classes. It might be yoga. It might be Pilates, or it might be swimming. So, start with something that's going to be on your level if you're just starting, and then progress from there, and you don't want anything that, is going to hurt you or make you, have any pain. It's like, I know that a lot of people say no pain, no gain, but at this point, I think that's not true. So.
Maybe in our 20s, right? But once you get over a certain point, no pain, no gain. If you have pain, we should stop, is what we're saying.
Yes. And then also make sure that you have someone, if you're going to the gym, make sure that someone's spotting you. Someone is going to be, a professional, have an athletic trainer over there who's going to make sure that you're doing the correct form when you're doing some weights and when you're, lifting up 150 pounds. So make sure that someone is there with you to make sure that you're doing certain things correctly.
That's an excellent point. And a lot of gyms, if you do go and ask, they will send somebody over to make sure that you are doing each machine the way that they are meant to be done safely and appropriately. So that's a great tip. Carol, let me ask you, since a lot of insurance companies sometimes have gym memberships as a perk or benefit, are there some lesser known benefits like that in health plans that people commonly overlook?
Oh, definitely. So many of them. But before I answer this question, I'm going to ask a rhetorical question to the group. How many of us have ever gone online and set up a member account? Do you ever look at your summaries of benefit? Do you even look at what it means to have hidden perks and discounts? No. Many people do not. So let me just remind everybody what these hidden perks and discounts are. Wellness rewards. So many people can earn gift cards or premium discounts by tracking your steps, getting a physical, or even completing a health survey. There's so much money to be earned in rewards. Set up your account, go through the summaries of benefits, and just ask your healthcare agent what these are. Another thing is we're talking about healthcare, being healthy and all of those things, fitness and lifetime. There's so many gyms in our areas. Oh my God. Check your plan portal for discounted gym memberships, free health coaching, subsidized weight loss premiums. Let me say that again, subsidized weight loss premiums. So much is so much talk. We have so much talk about Ozempic and all of those things. Do you realize in your healthcare plan, there are so many subsidized programs that can help you to reach your healthcare goal? Another thing that is taken for granted, and it may be going away at the end of this month, and I have to double check, is telehealth. So many persons don't realize that it's free to talk to your healthcare providers by telehealth. Hello, we're maximizing our healthcare benefits. And do you realize that instead of going to the emergency room, the ER, you can actually get a lot of those services through the urgent care, and they are much, much cheaper. Guys, this is about maximizing your health benefits for 2026. Some other cost savings tactics, stay in network. Yeah. Some of us may have an EPO or an POS plan. Stay in network. Verify the providers. You have pre-negotiated lower rates. Switch to generic drugs. As a healthcare agent, I see so many persons coming to me with higher tier level drugs, and the doctor, well, defer to your doctor, but there are so many generics that are alternatives to all of this. Are we using acupuncture? Are we using so many other things that are provided within your plan? All right, so these are many of the hidden perks and discounts, and you can take me for lunch if you use them this year and maximize those benefits. And I strongly encourage you to do so.
Excellent, Carol. Thank you so much. I love how enthused you are about making sure everyone is taking care and making sure that they're maximizing their benefits to get this support. And so much of this support also matters emotionally and not just physically. So, Monica, I want to ask you a question when it comes to making sure that we're getting them there early. What about recognizing maybe signs of depression, either in yourself or a loved one? What should you be looking for just to make sure? And what do you do if you're concerned?
No, and thank you, Angie, because I think that is so important, right? A lot of people just feel like, oh, anybody can be depressed. But when we are looking at depression, we're looking at a persistent and severe depression, right? At any moment, we might have a moment of sadness, but it's when that depression really turns into over 6 weeks, we're looking at key elements such as there is an impact on the energy level. There is an impact on they're no longer doing the things that they used to do, going to the gym, gardening, painting. Their sleep definitely gets impacted. We are seeing that with the Aura Ring, a lot of people are able to manage, how much they're sleeping. Their eating habits change. And the biggest thing that we see is when they're beginning to withdraw from their loved ones. They're no longer going to the family functions. They're no longer going to go see friends, right? That's when we begin to really see that they begin to just take a step back from the things that used to just give them joy. So what do we do when somebody is feeling, because when somebody is struggling with depression, they might not be the first ones to notice that, wow, I'm really struggling. Family members are the first ones to really come in and help. But we have to be able to reduce a little bit of the stigma surrounding depression. So that's where intervention, having a family member step in, being able to share, hey, I'm concerned about you. I notice that you are not doing all the things that you used to do, offering help, whether it is that they go see their primary care physician, or they go to see, sometimes they have a psychiatrist that they work with. But that intervention is really key to get somebody in the road to recovery. Because what we know with depression is that the longer we wait, the harder that it is. And the things that we look for when somebody's struggling with depression is when the hopelessness sets in, because that's really when us as mental health providers really step in, because that's when they lose the desire to be able to create a change. Even going to the gym, kind of what Josette was saying, just becomes such a monumental task that they are not able to really step into. So intervention is key, partnering with a primary care physician, being able to talk to a therapist. And to what Carol was saying, also within mental health, we have telehealth services. So if they're not able to get out of their home, they're able to reach us through telehealth. We're able to do just even like a simple screening for depression or anxiety to really make sense of where are they with the symptoms and what kind of intervention they actually need so that we could help them into the road to recovery.
Awesome. Thank you so much, Monica. A lot of what we've talked about today has been intervention, making sure that we are intervening early, that we are doing it as often as we can and as often as our benefits allow. But also, long term, how do we sustain that over the long term? And that can always be a challenge, right? I mean, there's a reason why we all need resolutions every January to get on the road and try to keep this up for the whole year. So, Josette, I want to go to you real quick. What advice would you give to someone who has specific fitness goals but struggles with consistency?
The best thing from my standpoint is really to have fun. It's like find an activity, and whatever your fitness goal is, find an activity that's going to be fun for you. Like I said earlier, the gym might not be the place for you, but going to a dance class might be a good place for you. I've had several patients who did not want to go walk, but the yoga, class was very good for them. There are yoga classes in the parks that you can join. It's not only good for your body, but it's also good for your soul, because then you're going to be in a class with different people. And so your mental health is going to be improved with this interaction with people. And again, do it in micro steps. So if it's only, don't look at it as don't make goals that are too big for you that you cannot meet those goals, and you're going to be frustrated when you don't meet that goal. You cannot say, oh, I'm going to lose 100 pounds, and then you only lost 5 pounds, and then you're so frustrated that you don't want to continue anymore. So make sure that like I said earlier, don't look at that big step, make little steps towards that goal. If you're able to do 10 minutes today, then add 5 minutes tomorrow. If you're only going to do 10 repetitions of an exercise today, then add another repetition tomorrow. So those little steps actually are like achievements for you, so that it motivates you to go further and further into your fitness journey. So, and if you're not able to go to the gym, you can go swimming early in the morning or even late at night, whatever fits your timeline. Like, don't make it such as, like, I'm going to do it. And then if you don't do it, it's like, it's going to be a frustrating thing for you. It's like, also make sure that you celebrate your small victories. So if you were able to say no to the chocolate today, it's like celebrate it by probably walking around the block and say, hey, it's like, I didn't do this and I'm going to do it by, walking around the block for 5 more minutes. So have a reverse, like think it in a reverse way. It's like, make sure that you celebrate your victories with something that is fitness related. So, and then again, make sure that you have fun doing certain things. Even if it's just gardening, that's movement already. It's like, if you like, sweeping the floor, which I know most of us don't like that, but if that, motivates you to do something, because it's still movement. Be happy about that. If you like yard work, then do yard work. If you like gardening, then do yard gardening. If you just like, dancing a little bit for 5 minutes, that's movement. That's great. Just make sure that you start. and be committed every single day in small steps.
Yeah,
And
go
have
for that
fun.
first walk, take a class of something fun. I love it. I love it. It
Mhm.
really does sound like, having that long-term success will depend on your mindset and a little bit of coping skills as well. So, Monica, let me ask you, what healthier coping skills can replace turning to maybe, alcohol or any other substance during stressful periods?
Yeah, because let's face it, I think we all have the hard day or the hard week, and for a lot of us, right, the tendencies we go home and we have a drink, whether it's alcohol, wine or beer or other substances, and every so often, in moderation, it is something that a lot of people can do when they're feeling stressed out. The issue becomes when it's something that we do every single day, um, and it's in the quantity that we consume, right? Because we turn to it to numb us out, but it doesn't really resolve anything. So one of the first things is to notice, wow, am I having the urge to just come home and have a drink or smoke or any other substance? What is that really about for me? Sometimes we have family members telling us, hey, honey, I'm noticing that you are, overdoing it. Listening to our family members who are kind of gently reminding us, but noticing, okay, my trigger might be when I come home, I have the urge. I'm replacing that urge with another habit, as what you said was saying. We could go for a walk, we could go to the gym. We're able to do any other habit that is pleasurable. If we are not able to get out of the house, calling a friend for sure, taking a walk with a pet, doing anything else that would also bring us a relief is key. Asking those around us, hey, really trying to cut down when I come home from whatever substance I use. Can you help me out with it? You'll be surprised how many times family members are more than on board to help to reduce that problematic behavior that we're doing. Also, just being compassionate with ourselves. Just the first step is awareness. So if we notice that we are overdoing it, we have to sometimes give us a kudos for like, okay, I am changing it. New year, new me. I want to change this thing that no longer works for me. And if you're still struggling and you find that no matter how hard you're trying, then definitely partner up with your primary care physician, partner up with a therapist who could definitely give you the tools in a daily basis so that you're able to break this bad habit.
Yeah, and that's a great point. So many of these habits tie back into our medical and preventative care systems. So, Dr. Goldman, let me ask you, what happens after a physical? How are those results shared? When should someone follow up? What should they be looking for?
Yeah, I think that depends on the provider's style and what's happening with the patient. Um, in a lot of cases, providers want patients to come back in to go through results. I typically alternate in person with on the phone or through a camera like we're doing now. And that way I can do the physical and then do a virtual later on to just touch base, make sure everything's in line, answer any remaining questions or concerns, and then just go from there. I always tell people if you are ever told no news is good news, my advice is don't listen to that. Make sure you follow up on the results because I have seen patients in the past go through some pretty scary stuff that should have been communicated that wasn't. So always follow up on results. Make sure that you know what's happening. Ask the provider, when they think they should see you again. Generally speaking, every 3 to 6 months, if you have some issues going on. Every 6 to 12 months, if there's not too many issues going on. It really just depends on your particular situation, and that's decided between you and your provider. So talk to your provider about that. Make sure that you have clear next steps. If you start a medication with your provider, make sure that you and or they are touching base with one another to talk about how things are going, if you're noticing any side effects, what your numbers are doing in response to, or how you're feeling in response to the medication. I think these are the big ones. And maybe a small plug for what I do. So there's really three main avenues to primary care. There's routine primary care, which is what I've sort of been alluding to throughout this talk. There's concierge medicine, where you pay an annual membership fee, and you typically have 24/7 access to your healthcare provider. And then the third avenue is what I do, and that's called executive medicine. Executive medicine is a very comprehensive annual visit. So you typically come in for 1 or 2 days, and for the entire day, sometimes it spills over into 2 days, depending on how much we want to do. We are screening and testing for a very long list of things. And a week later, I send you and your primary care provider a very long summary of everything that we talked about, we covered, and we found. And that kind of helps guide the decision making between you and your primary care provider for the entire year. So there's different ways to go about approaching your healthcare. It just depends on, what you want and what you think is best for you.
Thank you so much, Dr. Goldman. You've alluded a couple times to what I consider being called just active advocating for yourself as a patient. Before you go into that, sitting with your physician, are you asking all the questions? Are you remembering, to follow up? Like you said, don't wait for them to call you. Go ahead and follow up with your doctor's office and make sure that you've got, all of your next appointments and prescriptions and everything set up, because systems can be what they are, and we want to make sure that nothing gets left out of being reviewed with your doctor. So those are excellent points. Thank
Angie,
you so much.
Sorry, if I can add one last thing. I won't say how old, but I have a patient who's over 105, and I've asked her what her secret is, and her response is be assertive.
Absolutely.
Make sure you're advocating for your health.
Yep. I think that, and if it gets us to 105, I'm gonna start right now. That's a great advice coming from her. So that's wonderful. So when it comes to follow-ups and whatnot, Carol, this question is for you. Sometimes coverage comes into question. So I want to make sure that we also discuss what's one thing that people should be doing annually to make sure that their health coverage still fits their needs.
They need to review with their health insurance agent. And it is one thing to have health insurance and to speak with an agent, but there's another thing about having a relationship with your health insurance agent. Even if some of your plans allow you to automatically enroll, you need to have that revisit to see if your income allows you to get more subsidies if you're shopping on the health insurance marketplace. And with that, I'm glad you asked me that question, Andrew, because I want to, even though subsidies have not been extended and the premiums have gone through the roof, many persons are pivoting to bronze plans, which are only covering 60% of the cost. The silver plans, a lot of people and families are still qualifying for CSRs, which are extra savings on the silver tier only. So it is critical for them to have that discussion with their health insurance agent, because if they qualify for that extra savings, it will pay their deductibles, co-payments, and co-insurance. It's great to have an agent who is a broker, like myself, that works for so many companies, where I can look at the different plans and compare them side by side. And my analysis many times goes for days before my clients make their decision. It is critical that they do so.
Yeah, absolutely. Make sure you're reviewing that coverage every single year. It can change and we don't even know.
Yes.
What you have in your current plan can change, and sometimes you're not notified on time. You may be in the middle of medical treatment right now. And it's super important to stay on top of that. Thank you
And
so
I
much
just
for
want to
that.
say something, Andrew, that a lot of my clients who are finding that they have to do surgeries, they're coming back to me now because they decided to take the cheaper plan, not realizing that when it was time to do surgery, they're going to be coming out of pocket with a lot of money. So sometimes you have to make that sacrifice in the types of plans that you choose.
Yeah, make those adjustments if you see something
Yes.
coming on the horizon. Excellent
Yes.
point. Thank you, Carol. Okay, panelists, we're going to do one final lightning round question. I want to ask each of you, what is one small, realistic action someone can take right now, today, this week, that can help improve their health? Dr. Goldman?
Yeah, I think this goes back to um, just keeping track of what's happening in your life. If you're not doing like a daily journal or a weekly journal or even, monthly or a quarterly journal, just to jot down your thoughts, how you're feeling, what's going on lately, and so on and so forth. It's probably best to do that. it's really nice to hand over whatever's on that piece of paper to your provider because you'll get more out of your sessions, more timely feedback, and you'll get the most out of your appointments that way.
Excellent. Excellent point. Josette?
The only thing I can say is move. Get off the couch, get off the chair, stand up, do anything, even a small movement can help, and just move every single part of your body. It doesn't matter how long it takes. Just do a small movement at a time. That's what matters. Get off the couch, put the phone down, and move.
Move. We're going to move and we're going to track it. All right.
Yeah.
Monica, how about you?
Absolutely. So it's having a moment of gratitude every day. If we are able to close the night, just reminding yourself what is the good things that did happen, right? The noise is always there about all the things that go wrong. But every day there is something good that happens for us. That is how we keep, that positive moment, and we stay away from, or it helps us to not feel as depressed. Part of what Dr. Goldman was saying, if we're able to just have that journaling, if we journal the good things, what am I learning today? What's making me a better person? That is how we continue to move it forward as we go on in our lives.
I think that's an excellent point. I was going to bring that up as well. We should be tracking our gratitude also. So
Absolutely.
we're going to move. We're going to be gracious about it. We're going to have the gratitude and we're going to track it. And Carol, what about you?
Well, you asked me for one, but I'm going to give you two. Many of us procrastinate. We don't get our flu shots. I am one of them. So please, I'm encouraging everybody because I've been seeing too many of my clients and my friends getting the flu. Go out and get your flu shots. And the second one is cancer screenings. Guys, I cannot emphasize that enough. Please, this is coming from experience as an insurance agent. I'm seeing so many persons getting the big C. Thank God there are, if you catch it in time, there are great success stories. I'm urging everyone to get those screenings. Get them off the couch.
So important. We're going to get up, we're going to move, we're going to go to our screening, we're going to go to the pharmacy to go get our flu shots, track all of our gratitude and track how we're feeling on a regular basis. Panelists, I can't thank you enough. Dr. Goldman with Cleveland Clinic, Josette Mullins with Memorial Healthcare, Monica Arroyo with Family Therapy Group of Weston, and Carol McCook Dixon, one of our valuable insurance professionals. I also want to give special thanks to our trustee partners at Cleveland Clinic and Memorial Healthcare. And last but not least, our healthcare committee for putting this together. This has been a great topic. I'm sure we can talk about this much more, but this healthcare committee is putting together some great events for you during the year. So we just want to wish everybody a happy and healthy 2026.
Thank you.
Thanks, Angie.
Thank you very much.
Everyone.